Come in.
Hi, my name is Lauren. I'm going to be your student nurse today. Is it okay if I do a head-to-toe assessment on you?
Yes, that's fine.
Okay, awesome. Okay, at this point I'm going to wash my hands and put on any gloves and mask. And then I'm also going to close the curtain for our privacy.
Okay.
Could you please state your name and date of birth?
Yes, Renisha McKinney, 04/24/1995.
Okay, perfect. And I'm going to assess the hospital band, make sure that it's correct, and it is. Everything matches. Okay, and do you know where you are?
Yes, I'm at the hospital.
Okay, and do you know what day of the week it is?
Yes, it's Thursday.
All right, and also who's the president?
Trump.
Okay, thank you for that. Okay, next I'm going to assess her skin. Looks like her skin is dry and she's not sweating too much. The color is appropriate for your ethnicity. And I'm also going to look at your hair. Okay, looks like her hair is clean. There's no bruises or any balding spots on her. Okay, I'm also going to look at your eyes. Looks like your eyes are symmetrical, your nose is symmetrical, your face looks symmetrical. Okay, awesome. Next I'm going to assess your eyes. I'm going to look inside them. Okay, awesome. I was checking for perla, which is her pupils are equal, round, reactive, and accommodating to the light. Okay, next I'm going to have you look at the top of my pen, and I'm going to look in 8 spots, okay?
Okay.
But I'm not going to tell the patient that. And try not to move your head, please. Good. Perfect. All right. Next, I'm going to look at your nose, see if your nose looks good. Okay, her nares aren't, they're not blocked or anything. Could you also pull down your eyes for me? Look at your eyelids. They look good. The whites of her eyes look good. There's no conjunctivitis. There's no redness or any drainage from her eyes. Her nose looks patent. Do you have any problems smelling anything?
No, I don't.
Okay, good. Then could you also open your mouth for me, please? Okay, and say, ah. Perfect. Could you stick out your tongue for me? Awesome. And can you put your tongue to the side? And then the other side? Awesome. Thank you. All right, perfect. Next, I'm going to look at her neck. It looks like her trachea is midline and it is even. There's no, it's not deviated. There is no jugular vein distension. Okay, and then I'm going to look in your ears, make sure they're clear. All clear. All clear. All right, awesome. Next, I'm going to palpate and feel for her carotid artery. It's present. And it's present. Next, I'm going to feel for all of her lymph nodes. I'm feeling behind her head, her neck. Okay, awesome. There's also lymph nodes in her armpits. I'll feel later. Okay, next I'm going to assess your clavicle. Okay, there's no crepitus or deformity. I'm also going to have you clench your jaw for me. Clench it and then open your jaw for me. Okay, perfect. Also I'm going to look at her chest if it's equal rise and fall. Looks good. Okay, and then I'm going to listen to her lung sounds. Take a deep breath in and exhale through your mouth. Okay, they sound all clear. And then could you lean forward for me, please? I'm going to listen on your back. Okay, all clear. And I'm going to listen on to your side. Okay, perfect. All right. Next, I'm going to have you shrug your shoulders for me and then relax. Then I'm going to push down on your shoulders and I need you to resist them, okay? All right, go. Good job. Then can you turn your neck both sides? Awesome. And then I'm going to put my hand on your face and push it against your head, and I need you to push against me, okay?
Okay.
All right. Good. Nice and strong. Nice and strong. Perfect. All right. So I listened to the lung sounds. I'm now looking at your, I'm going to assess your heart right now. All right, awesome. Heart sounds great. Next, I'm going to assess your arm, look for any bruising or any scarring. Looks like there's no scars, or there's one scar here. I'm going to look at your hands, assess your capillary refill. Looks good. Could you squeeze my finger? Okay, thank you. Then could you move your wrist for me? Move your elbow for me? Awesome, great range of motion. And then can you lift your arms? Okay, awesome. Then I'm also going to feel your armpit, okay, to see if there's any of your lymph nodes. Okay, awesome. And then can you do this as well? Bicep curls? Perfect. Awesome. I'm going to look on the other arm, assess your skin. Okay, looks good. I'm going to assess your capillary refill. Okay, perfect. And then can you squeeze my finger on both hands? Awesome. Then can you lift your arms up, and I'm going to push down on them and resist. Good. All right. Next, I'm going to look at your abdomen, and I'm going to first listen and then palpate, okay? All right, so there are bowel sounds. They're present. That's perfect. Next, I'm going to gently palpate. Are there any tenderness? No tenderness? Okay, good. There's no distension. Okay, and the color of her arms looks good. Next, I'm going to look at your legs. So it looks like your legs, there's no swelling or edema. Okay, perfect. Can you lift your leg for me one at a time? Okay, then I'm going to push down, and then I need you to resist. Awesome. Push back. Perfect. Next, I'm going to assess capillary refill of her toes. Perfect. Perfect. And then I'm going to feel for her pulses on her feet, her pedal pulses. They're both present. I'm also going to can you move your ankles? Awesome, all around, perfect. Can you push down like pedals like you're driving a car? Perfect. Okay, and then I'm also going to assess your femoral arteries. And I'm also going to assess your brachial artery. And then your radial artery. Okay, and then same on this arm. Awesome. And then I'm also going to have you swing your legs out onto the side of the bed, and I'm going to assess your reflexes, okay?
Okay.
Let me get it. There you go.
Got it out.
Okay. Perfect. All right. And at this point, I am done with my assessment.
Okay.
Is there anything, any problems urinating or going to the bathroom?
No problems.
Okay. When was the last time you used the toilet?
I urinated an hour ago, and I had a bowel movement earlier this morning.
Okay. Perfect. Glad to hear that. Then, do you have your appetite and everything? Are you eating well?
Yes, I'm eating pretty good.
Sleeping well?
Yeah.
Yeah. Great. All right. Well, thank you so much for letting me do my head-to-toe assessment.
Thank you.